Today we woke up with a heavy sound of shooting and bombings, and with some terrible news. Like a close relative of one of our team member lost her life during the attack of last night here in Rafah. So the mood is obviously affected by this military attack. The bombing is intensified during these last 2 or 3 days, and the people here are exhausted, tired, and desperate after a few moments of happiness when they announced the ceasefire, but this didn't happen. So here in Rafah, we are still continuing offering psychological care as much as we can, and in our hospital, and the constant sound of the explosion is making every intervention really difficult, with high possibility of triggering acute psychological reaction. This because this is triggering it's recalling the traumatic events that of course our patient lived many times in these 7 months of war. We are observing different kind of symptoms, psychological distress, as for example, we find a lot of acute stress reaction, but also depression, anxiety, irritability, problem sleeping, um, and uh, it's something that is impacting seriously the well-being of our patients. At the same time, here we are providing kind of psychological support also for our medical staff that is constantly exposed to the pain and story of our patient, and at the same time they are victims themselves of this war. And as other victims here, they lost their house, relatives, families, friends, colleagues, and of course, it's clear how this can impact on the mind of the people. So this is the actual situation here in Rafah in this moment. You can hear some bombings, not so far, but this is also the situation of this long exposure to the war, and this is why we demand for an immediate ceasefire.